Hi, and welcome to our weekly episode of Talking with Nurses College. Let's dive into the fascinating world of antibiotics and the conditions associated with their use. To start, let's define some key concepts. An antibiotic is a type of antimicrobial substance used to prevent and treat bacterial infections. It works by either killing bacteria or inhibit their growth.
Exactly, Dr. Green. When we talk about killing bacteria, we refer to bactericidal antibiotics. This drug whereby directly killing the bacteria, often by disrupting the formation of the bacterial cell or other critical structures, which leads to the bacteria's death.
On the other hand, we have the bacteriostic antibiotic which don't kill the bacteria outright, but inside inhibit their growth and reproduction. This allows the body immune systems to take over eliminate the bacteria. These antibiotics disrupt processes like a protein systems or DNA replications in a bacteria.
That's a great overview. However, we can discuss antibiotics without addressing bacterial resistance. This is the ability of bacteria to survive, multiply, and despite the presence of one or more antibiotics that will normally be effective. Resistance develops when bacteria evolve mechanisms to neutralize the antibiotics, such as modify the drug target, expelling it from their cells, or breaking it down.
Several factors contribute to bacterial resistance. Inappropriate use of antibiotics is a big one, like prescribing them for viral infections or not using the correct dosage. Self-medication is another issue. People often take antibiotics without proper medical supervisions, which can lead to resistance.
Don't forget about the excessive use in agriculture. Using antibiotics in animals to promote growth and prevent disease can lead the resistance strains that are transmitted to human. And of course, like of adverse treatment when patients don't complete their prescriptions and antibiotics course allows the bacteria to survive and potentials the pulse resistance.
You're right, and nosocomial infections in hospitals can further spread resistant bacteria. Now, speaking of adverse reactions to antibiotics, let's talk about red man syndrome. This occurs when the antibiotic vancomycin and is characterized by redness, itching, and rash of the upper body, face, and neck. It's caused by the rapid infection of the drug, leading to a release of histamine. To prevent it, vancomycin should be infused slowly, typically over 60 minutes or more.
Another condition we should cover is gray baby syndrome. It's a serious condition in newborns, especially premature infants, caused by the antibiotic chloramphenicol. These babies have immature livers that can metabolize the drug, leading to toxic levels. Symptoms include gray skin discoloration, low blood pressure, vomiting, and respiratory distress.
Then there are Stevens-Johnson syndrome, not common but serious. These are affected the skin and mucous membranes, often triggered by medications or infections. It starts with flu-like symptoms, followed by a painful red or purplish rash that spreads blisters the top layer of skin dyes and sheet, making this a medical emergency that requires immediate treatment in a hospital-borne unit or EUC.
Lastly, let's discuss pseudomembranous colitis, which is an inflammation of the colon caused by an overgrowth of Clostridium after antibiotic use. The symptoms include diarrhea, abdominal pain, and fever. The condition is marked by the formation of pseudomembranes of the colon lining. Treatment involves stopping the offending antibiotic and using specific antibiotics to target the infection.
In this condition, highlight the importance of careful antibiotic use and monitoring. And as you mentioned earlier, Lisa, gastrointestinal issues like diarrhea, nausea, and abdominal pain are common side effects of antibiotics.
Right, and we can't overlook the potentials for allergic reactions like skin rashes or, in severe cases, anaphylaxis, which is a life-threatening fungal infections like candidiasis, where antibiotics disrupt the normal bacterial flora can also occur, leading to the infections in the mouth or genital area.
There's also the issue of photosensibility. Some antibiotics can make the skin more sensitive to sunlight, leading to sunburn. And although less common, antibiotics can cause neurological effects like headaches, dizziness, or even seizures in susceptible individuals.
All of these factors remind us of the importance of prescribing antibiotics judiciously and educating patients on their proper use to minimize risks and combat bacterial resistance.
That note, I think, is important to mention the utility of blend cultures in antibiotic selections. Blend cultures are essential laboratory tests and used to detect the presence of bacteria or fungi in the blood, especially in the case of bacteriums or sepsis. On with identify the microorganisms cause the infections, we can perform an antibiotic sensibility test, also we know as an antibiogram.
Oh, yeah, and this test determines which antibiotics the bacteria are susceptible to, allowing us to select the most effective treatment. It helps avoid the unnecessary use of broad spectrum antibiotics and reduces the risk of contributing to bacterial resistance.
Absolutely. Blood cultures and antibiograms are vital tools that allow us from shift from empirical antibiotics treatments to target therapies, making them indispensable in managing severe infections. It's a delicate balance, but with the right knowledge and approach, we can manage this challenge effectively.
That all for our weekly session of talking with nurses. Stay tuned for new updates.
And remember to take a note of this news, knowledge, and the most important of all,
Share this with your family and friends so they can also learn something new and follow the recommendations. See y'all!